Hello, Cynthia Tieche here with Dr. Tieche on Coffee Talk with Dr. Tieche. And as you can see, if you are watching on Facebook Live, that we are at Recharge Clinic. This is actually the back of our clinic. We have yoga and things back here, but we decided to do something a little different this week. So if you're not watching and you're listening on the radio, then when you get home, go on and check it out, because you can see just a little tiny piece of our clinic today. Little tiny bit. So we have a couple of different topics we want to talk about today. We posted some videos actually yesterday and today about testosterone for women, and we had a question about that. So we just talked about that women do actually need testosterone, and then we talked about dangers and that, and then we had some questions about how much testosterone they should have. So if you want to answer some of those questions and just recap what you talked about in those videos.
So one of the things that frequently is asked, because most people know that testosterone is important for men, but when I tell them that it's important for women, most women and some men are a little bit surprised. They're like, women, testosterone, what? I don't want big muscles, I don't want this, I don't want that. And so when I go through it all, then it becomes much clearer. So there are a lot of misconceptions about testosterone in women and its uses and its purposes and why they need it. So men and women both need it really for the same reasons. Men have about 10 times the amount of testosterone than women do. So men's testosterone, men feel best when their testosterone is between 9 and 1100. Maybe a little higher, but that's kind of when men feel best. Women tend to feel best when it's over 100. And our target goal frequently when we're initiating therapy is about 150. And so what is testosterone important for in women, and what are its benefits? Why even bother with it? Well, testosterone is very important, and probably one of the most important things that I think it's important for with women is bone density. It is the only natural thing that helps reverse osteoporosis and actually prevent osteoporosis, which is a huge problem for women as they get older. Women are living much longer. Medical problems are well controlled: hypertension, diabetes, cholesterol, all of that, and they're living longer. But one of the common things that ends up being a mortality and morbidity for women, which means an illness and a death, is bone fractures. Women will break a hip, break an arm, and then they start a spiral downward because they just don't heal well because their bones are so thin. So testosterone helps naturally thicken bones. And what that means is there's two parts to your bone. There's the outer white layer of the bone, which is the cortex, and then there's the central part of the bone, which is kind of the marrow. And so medications that are used to increase bone density just really increase the cortical layer. So they make your bones heavier, but they also make them a little bit more brittle, where testosterone naturally increases the middle part of your bone and the outer part of your bone. So it makes it much more naturally healthier and stronger. So that's really a main reason that I like testosterone in women. It helps with muscle mass, maintaining muscle mass, because as we get older and our testosterone levels drop, no amount of working out, no amount of protein consumption is going to help maintain those muscles. So people start losing muscle mass, and you see as people get older, their muscle mass decreases. They start getting, smaller arms, and those arms start turning flabby. And so testosterone just naturally helps maintain that muscle tone. And muscle tone is important just because really the working of the muscles over the bones helps strengthen them. But more importantly, most of our calorie consumption is in our muscles. So in order to help maintain our weight, it is important to have good muscle tone. And many people continue to work out, so it actually helps their workouts. Their workouts are very effective. If they're playing tennis and golf, they notice their games improve and go back to when they were younger, because they start noticing that they're losing some of their strength and skill sets with that. The other thing it really helps with is mental clarity, motivation, confidence. And that works very well for men and women, but so women really experience this as well. And it does help with some of the ups and downs in moods. And I see this over and over again with women, that as they're kind of starting to go through menopause or just even prior to that, and their testosterone levels have dropped. They just say, oh, I'm just chronically in a bad mood. I feel depressed all the time. I'm just unhappy. And many times they are mistakenly put on antidepressants because they do have the symptoms of depression. But once their testosterone is optimized, a lot of those symptoms go away, so those medications can be removed, because it really does have a strong effect on mental function, and it does on men as well. And so that's a big thing. It helps with cardiovascular stuff.
Question about that.
Yeah.
So we were just talking about this earlier, actually. So when you talked about moods and that, a lot of people, and women and men, a lot of people think that, oh, I'm cranky all the time, it's because my testosterone is too high. But really, you're saying it's actually the opposite, and it will help you be in a better mood.
Exactly. So most of the time, and I don't know where they would get that idea that their testosterone was too high.
Most people do think that.
I know, and it's never accurate at all. Testosterone is actually, to most people and even bodybuilders, fairly calming. I like to use the word sedating, but it's kind of an inaccurate word, because sedating makes you believe that it makes you sleepy, but it does not. It honestly makes people more relaxed and more just comfortable.
I feel like it's not like a physical relaxation that you're saying, because I know for me, like, it does help my moods. And so when you said sedating a while ago, we had talked about this, and I'm like, I don't want to be sedated, but it doesn't make me feel sedated. It just, I feel like it helps control temper, maybe. And
it does. It helps take some of that anxiousness away, and some of that anxiety. So in that way, it is calming and sedating. Some of these characteristics, and I have a difficult time explaining, because there's really no words for some of them. And but once someone has had it and they make that transformation, it becomes very clear what I mean for that, because they just say, I know what you meant.
Yeah.
And so that's another big thing. So it helps the cholesterol metabolism and triglycerides as well, which frequently we see as people are getting older are getting out of balance. Initially, people are put on statins, but many times it's optimizing people's testosterone over time will bring those numbers back down again. And the other important thing is it helps with sex drive. It helps return people's sex drive back to a more youthful time. And, that is an important thing, because as people are living longer and healthier and want to maintain their youthfulness, really, we're not ready to die at age 40. So most people I'm seeing late 30s, 40s, 50s, they are in the prime of their life, even though, in days gone by, that was an older age. Now it is not. That is the age. And so people are not ready to just sit down and start crocheting and sitting in their rocking chair and just going away. Well, it's the truth. It is the truth, because there are doctors who are telling these people, you just need to learn to grow old gracefully. What does that mean?
In your 30s.
And that's what they're telling them. So that's my big thing is, no, we're not going to grow old gracefully. We're going to go kicking and screaming. And, we're not doing anything artificial. We are not manipulating science. We are not doing anything that's wrong, that's going to, distort anything. It is just optimizing these hormones that have dropped. We do it in diabetics. Their insulin levels are out of whack. We optimize that. So it's done over and over again in the rest of the body. But for some reason, people have a hard time grasping it. A thing to realize too is testosterone replacement has been around since the 1930s for women. So it is, almost 100 years old that people have been doing it. So it's nothing new. It was widely done. And it was done really up until the 60s, when big pharmaceutical companies really kind of suppressed that and controlled the medical information and wanted synthetic substitutes, synthetic hormones and stuff like that.
And that's
when the problems happen, because people go, well, these hormones cause cancer. Well, the synthetic ones do. The bioidentical ones don't. And so there is a lot of confusion, because guess what? The synthetic ones were pushed on people quite a bit. And because doctors were trained with these things, and they were taught by pharmaceutical companies and by their professors that it was healthy and these were the things to do. As an aside from that, if someone doesn't believe that that's really true, that pharmaceutical companies have a big influence, and I didn't want to believe that as a doctor. I wanted to believe that the information that I was being taught was completely accurate. Just recently in the news, really over the past week or so, the head researcher, the head oncologist at Sloan Kettering Hospital in New York, was just resigned and fired because he had accepted over the past 3 years $3.5 million from Bristol Myers, and because he was supporting He was saying, giving favorable reports on one of their cancer drugs that no other university, no other medical center had found the same results. Their results were not as good. But he, since he had received monies in grants and stuff like that, as well as personal funds, was doing that. So if people don't believe that this stuff really goes on, this is in the news. It's really quite sad. And so,
Wow.
so I mean, you talk about someone who's monkeying with data over people's lives like that. This stuff happens over and over again. So it's real.
Yeah, so you can't just
believe it. I mean, it happens all the time.
Yeah.
This is just 1 week ago. So it's
Wow.
right in the news.
Yeah. Well, and that's one reason that our clinic doesn't process insurance, is because we don't want to be told how to treat the patients and what to prescribe for them. He wants to prescribe what's needed, and so really it's hard to work with the insurance companies because
It is in many levels. Not only do they want to tell you what to prescribe, what medications, what dosages, how often to see patients, and really all of that. They want to decide everything I'm going to do, how I'm going to practice from start to finish. And since we're not beholden to them, I can see a patient every day, once a month, once a week, however much they need based on their own individual needs. And I think that's how medicine is meant to be practiced. Some people don't need to be seen often. Some people need a lot in the beginning. But you have to tailor it individually, not a protocol. Oh, you only get this allotted amount. It's just not one size fits all. Everyone knows that.
Yep, and that's really why I think our patients are pretty happy. I mean, it stinks that they pay for their insurance and maybe don't use it here, but we do give them receipts and some of them get reimbursed for it. But it is nice that you can treat them and help them the way that they need, not from just some insurance company telling you what to do. So, yep, someone commented, insurance is a joke.
Well, you know.
Yeah. We pretty much, I consider us the rebels in the medical field right now. And there's other clinics that are similar that we're just not going to be dictated.
Well, they want to control what you think and what you do. And you know, it's just not fair. You know, in the old days, there was the doctor-patient, relationship. And that was really where it started and ended. And now that insurances came involved, and now it's sort of like patient, insurance, doctor, that's the triad. No one can speak directly. We have to go through the grand master, and they don't care. Their motivations are not health, they're profits.
Yeah, it's sad. And that's why people really aren't getting good care, and people are frustrated. And it is nice to be able to not do it that way and do the right thing, really. But that's why we actually call what we do old-fashioned medicine, or old-fashioned medical care. That's what we say, because it is very old-fashioned. They get to talk to you.
I thought you just said it was because of me being old.
And you are
Okay.
old-fashioned.
That's what I really thought you meant by that.
Yeah, that's our thing, old-fashioned.
Emphasis
on
on
old.
well,
Okay.
I'm seasoned.
So we are going to go to a commercial break, and we will be back. So if you're watching us on Facebook Live, you have a treat today. The radio that we're on is going to a commercial break, but we are actually going to talk to you a little bit more and introduce you to some of our staff. Lucky them. Come on over, Chase. This is one of our favorites. No, I'm just kidding. We love them all.
Favorite, that's okay. You can say.
This is Chase, one of our paramedics here. How long you been here? Well,
I've been here actually, 8 months, almost 9 months.
yeah, almost.
Closing in on a year soon.
That's right, yeah. So if you ever come for a vitamin IV, you're definitely going to see Chase. He actually helps out quite a bit in like every area. If you're for weight loss, for shots.
Jack of all trades.
Yes.
So in fact, I mean, I was not feeling that great today and started getting a sore throat. And as you can see, Chase gave me a wonderful IV a few minutes ago, and painless and without a problem. And so, that's one of the things, I think that people need to remember that, we do lots of IVs.
Yeah, I did want to mention that today, that you had gotten IV.
Yeah, absolutely.
Flu season.
Yeah, flu season's coming up quick. It's coming faster than anybody expected it. It's worse than anybody expected it. I was starting to get something last week, and as soon as I felt my throat start to scratch, you guys know that crappy feeling when you're about to get sick, I went ahead, got the recharge with the immune boost, it never really hit me. It just went away. Kind of stops it in its tracks. If you're starting to feel it, if you're already too deep into it, go ahead and come get one. It'll cut the life of it down. We'll shorten it up and get you back to work. Because nobody's got time to be sick right now.
No. And this flu, ain't nobody got time for that. This flu is bad. This one is, I think, looks pretty rough. What's happening with people? 2 minutes. We got 2 minutes left, or we're done. We're done. Oh,
So
well, get on. Nice. Thanks for coming on, Chase. You did good. Okay. Cynthia here with Dr. Tieche. We're coming back from our little break. If you were watching on Facebook Live, you got a little treat today. You got to meet one of our paramedics, Chase. He came and visited us on the show. But we were talking about testosterone, and we've got some other topics to talk about today. What was your first one you want to talk about?
Well, I had some interesting patients this week that have brought up a variety of different topics that we don't always talk about. But one of them was that I wanted to talk about was and I don't know if people are aware of this, but there's a new medication out there, and it's called Truvada, but it also goes by the nickname of PrEP or PEP. And are you familiar with that at all?
Well, actually, we never watch TV, but then I happened to watch TV like a week ago and saw a commercial, and I saw a commercial for that, and I was totally shocked because I had never heard of it. So that was just a week ago. Pretty interesting. So I'm sure most people haven't heard of it unless they've seen it.
unless you're someone in the know. So Truvada, or if you want to just PrEP, but that's the real
This
name.
is really interesting.
It's fascinating. It is finally, there's a new medicine. It's a combination of an antiviral as well as another medication that is finally out there to target and actually help prevent HIV infections. So what the term PrEP is pre-exposure prophylaxis. That's what the letters stand for. So what does that mean? That means that you're going to take this medicine before you've been exposed to the virus. And so this medication is meant for people who are in higher risk groups, who have a higher chance of developing or coming in contact with HIV infections. And so there's 40,000 new cases of HIV a year, and it seems like it would be higher than that, but that's what I saw. And so the thing is, we want to try and cut it down, because many people don't know if someone else is exposed to it or has HIV. So you have to try and limit it the best you can. And this medication is out for prophylaxis. And so really, what is it for? Who are the targets? So like I said, it's out for people that are at higher risk groups. Well, one of the high risk groups are heterosexual couples who one partner may be HIV positive for whatever reason. It doesn't matter what the reason is, but they now are that other person, the other partner is now at risk. But taking this medication
is it an everyday? Is it oral?
It's an everyday medicine. You take it every day. Prior to beginning treatment, you are tested for HIV as well as hepatitis B. You take the medication every day, try not to miss any days, and then you are tested periodically throughout to continue to confirm that you are HIV negative as well as hepatitis B, because the two tend to go hand in hand. But there's anywhere from a 75 to 90% reduction in the chance of that person converting over to HIV. Really? That's crazy statistics.
Yeah.
That's really, really something. So, there's a whole bunch of other people that are exposed. There's the homosexual population, people who have used IV drugs, all kinds of things like that. There are people who've been exposed, blood contamination, that have HIV. So the same thing is, by taking this medication, if you just happen to be in what you feel to be a high-risk group, it cuts that chance down quite a bit. I mean, you're talking about a life-altering medication.
Yeah.
And so there's really two ways that people are taking it. They're taking it as the PrEP portion, but there's also works as the PEP version. So what does that mean? That is the post-exposure prophylaxis. So in other words, if someone got it, had a contact with someone who they thought or maybe was HIV positive, whatever that exposure might be, you know, you can fill in the blanks, whether it be sharing a dirty needle, sex, things like that, or being exposed by an accidental needle stick. You can go ahead and start this medication, and you typically end up taking it, you know, for several months after that, and then it's really pretty much limited the chance of you seroconverting or converting over.
So that's pretty nice for someone in the medical field who gets an accident stick or something.
Yes,
Contaminated.
because that has been the biggest fear of
Yeah.
people, and there really had not been a lot of things that were done. They would give you a gamma globulin shot, and then they would just serially check your titers, which is checking the blood levels. Well, that's kind of almost like checking it after the horse has left the barn. I mean, if your levels are positive,
now what?
You've already got it.
Right.
You know?
It's like
So now there's actually a medication that's out
cool.
there that can really help prevent it. Now, the only problem with this medication is
Let me
it's
guess.
incredibly expensive.
Yeah.
And that's what it is unfortunately a sad fact.
Just wow.
So a person was telling me that if you do not have insurance, it's approximately $3,000 a month. So unfortunately, this is really a sad state because, you know, there are some insurances and some prescription plans that are helping people be able to get it covered, but still, even with the help, it's not down to a really low level. So now we have something that we know that people can really prevent this devastating disease, who we know is basically going to ruin someone's life, probably strain them financially, but yet just can't afford it.
How long has this been around?
Well, you know, there's been a lot of variations of all these antiviral medications, but this is the first one that's come out, you know, as this.
For this, like this year or in the past few years, you know? No.
Honestly, I don't know.
I'm wondering if it's maybe going to get cheaper.
I'm sure it will
but
get cheaper,
probably-
you know, and I would love to believe that, you know, someone would subsidize this, but, you know, as all pharmaceutical companies do, this is their opportunity to rake the public because they put all of their expenses into, you know, pay for research, development, go through FDA approval, and now this is the time to recoup the funds. And so, you know,
That's crazy.
yeah, it would be nice to think that it was available.
That's crazy.
You know, even if you look at just providers, I try to do a little more research on it on my own as far as Googling providers in this area. And there's really very few providers. There's one provider in Ocala only.
That prescribes it? you
Yeah,
mean?
the rest is health departments.
Wow.
So it's, you know, the medicine's out there, but yet it's like even very difficult to get because most people don't get care at the health department.
Right.
And so, you know, so it's kind of a mess, you know.
Wow. So there are two different drugs. One is pre.
No, it's the same medicine.
Oh, it's the same medicine. So you
Same
can take it before
Even.
or even after.
Correct.
Same thing. Okay.
Correct. Yes.
And so the one before, you basically are just taking it as you're in your time of your life where you feel like you're in high risk.
Yes.
And then if you're not in high risk anymore, then you stop if you haven't been exposed.
Yes.
Interesting.
So, you know, there's some other interesting statistics, and I shared them earlier that, you know, so there's high risk groups, but then there's high risk areas in the country.
Oh, yeah.
And so this was kind of eye-opening for me, you know. If you look at the map, there's very high risk areas throughout the country, high risk, medium risk, and low risk. And the places that I thought were super high risk were not. And so it's not really what I thought. So the places that are the highest risk are Washington, D.C. is the highest risk with the highest incidence, like 1 in 13 chance of getting HIV.
Oh.
Maryland
my
is next at 1 to 40. And then Georgia is third at 1 to 50. And then Florida is fourth in the country at 1 to 54. I thought, stupidly, New York, California, these really metropolitan drug all areas that we think they're not. They're in the lower range because maybe people are more educated, maybe people are practicing safer methods, but they are not. And so they're in a lower stratus. They're in a lower thing, like 1 to 200. So it's way lower.
Wow.
And then the next lower ones are pretty much areas that are fairly remote, like Montana, North Dakota, those areas where there's pretty much no population. But those are that. And I found that to be kind of interesting, that I would have not thought that Florida would
I
have been
know.
such a high risk area,
No.
but in fact it is. It's one of the highest risks in the country.
Wow.
So that's something to be concerned about.
That is scary.
Mm-hmm.
Wow. So 1 in 65 is Florida.
1 in 54.
1 in 54. Wow.
Yeah.
So, but I don't know if you've done much research on this, but so the people who have already been exposed and have HIV, it seems like there's much better care for them now, and they're living better now, and
Absolutely.
living a lot longer,
Absolutely.
and feeling a lot better, and
Absolutely.
there's a lot for them.
So yeah, there's a lot more suppressive therapy. Basically is to try and suppress the viral load as much as you can and do that. So yes, that is. So along talking about viruses, another thing I wanted to talk to you about, because this comes up quite often, is HPV, which is human papillomavirus. And this comes up really for both adults and for children, and children, I mean really young boys and girls who were in their early teens. And so unlike HIV, there are 3 million cases of HPV per year.
Wow.
So it is super common. And some estimates say that almost every female by the time they're in their 20s has been exposed to or infected with HPV in one form or another. So, there are a lot of varieties of it. There's, more than 20 different strains. And so some of the strains just cause warts. You have warts on your hand, or they can cause genital warts, things like that. But so those are those.
Warts on your hand?
Yeah, warts.
That could be a type of
HPV.
But maybe
Maybe
not
genital
from
warts.
sexual contact, maybe just
Exposure.
exposure.
Yeah,
And
it's not sexual.
what other ways? Sharing a drink?
However you're going to get exposed to that, yeah.
Interesting, okay.
So then there's really two main ones that are just mostly linked with cervical cancer or cancer in men too, and there's two strains that are of all of those strains, and those mostly cause cervical cancer, and then men they've been the ones that have been implicated with the tonsillar cancer as well, which are one of the main reasons why people are pushing for the vaccination, both in girls and boys, because what happens is, everyone worries about the girls, but the boys become the carriers. And so guess what? We just live in a very promiscuous society, and you can make any kind of moral judgments or moral opinion about that, whether it's good or bad or otherwise.
But it is what it is.
It is what it is. And the reality is, if you have teenage kids out there, how are you going to deal with this? How are you going to protect them? Do you get the vaccine? Do you not get the vaccine for your kids? Knowing that there's probably 100% chance they're going to get exposed. That's scary, because for girls, that's going to lead to, doesn't mean they're all going to get cervical cancer, but they may get abnormal pap smears, they may get venereal warts, and it could turn into cervical cancer. Which, if it's an aggressive form, they may have to get a hysterectomy. They may have child may not.
So, and this can be
children.
prevented with that vaccine.
Yes.
But what I've we have teenagers, so I've talked a lot with parents about this, and their concern is, how safe is the vaccine? What are the risks for the vaccine? And
The vaccine
people really
is-
don't want to have their
Right.
kids get it.
And that's true of a lot of vaccines. People are very scared of all sorts of vaccinations because you are getting a virus. It's what's called an attenuated virus. That means it's been changed to stimulate your immune system to prevent it. The success rate of people who are vaccinated against getting infections is very good. So it really does the job of suppressing it and preventing it. That part's good. Now, what are the chances of there being a problem, and what are the problems? So the most common problems that people get after vaccination are, the first group is the minor ones: redness, slight fever, hives, things like that. Those are mostly annoyances, soreness at the injection site. Those, even though those are annoying, those are not bad.
Mhm.
But there are very rarely some neurologic problems that happen. One is Guillain-Barré. That is a kind of paralysis that people get from a viral infection. Sometimes that is very transient, and what that means is it comes and then it goes after that exposure has been gone. And there have been a couple of cases reported of actually paralysis in some people. So the numbers are very small.
That's scary, though.
It is scary, but the numbers are small. So you have to look at the whole thing and go, okay, what are the options? The options are, do I risk having these side effects?
What are the numbers?
They're very small compared to really good. really small having a problem to excellent prevention. So we know when they've looked at these kids that they're going to pretty much have 100% exposure unless you were lucky enough to have the one child who did not have sex until they were married. Now you have to hope that
that person didn't.
Because that's really how it's transmitted. So, what happens is each person's number of sexual encounters multiplies the risk of getting this exponentially. So one person could be uninfected, the other person could have had some bad exposures, and now we've got the problem. So that's the thing too, is, what's going to happen? How do you control all of that? The odds of both of them happening, that you're going to find two people like that, is honestly, unfortunately, going to be low.
Yeah.
And so you have to use that in there and kind of try to make your best guess. I mean, yes, in the perfect world, we would give it to anybody. We wouldn't need to, but we don't. And this is a real entity, and this is really a significant problem. I mean, it's so common. It's just incredibly common.
So your recommendation is to?
Well, we vaccinated our daughters, and I think it is important. But I think everyone has to decide that on an individual basis about what they want to do with their children. But I think it's important.
One risk or the other risk. Either way, it's going to be a risk.
Mm-hmm. Yeah. Yeah, it's a no-win situation. I mean, that's the problem with it. It's a no-win situation. I mean, who wants to? We don't want to be in that situation. But guess what? We all. And you can't put your head in the sand and say, I just don't want to deal with it. Okay, well, guess what? As we all know, I mean, teen pregnancies, teen sex, all these things are going on, whether you want them to be or not. We don't want them to be, of course, but they are.
Yeah.
So.
A lot.
Yeah, it's just crazy. So.
Okay. Am I allowed to move on to the next topic?
Of course you are. You're always allowed to.
So we have a lot of questions about medical marijuana. And I think, we do believe in that, and he prescribes medical marijuana. I think I want to talk about a couple things. I want to talk about medical marijuana, but I want to talk about the process of getting medical marijuana, because that's where there's still a lot of confusion for a lot of people, because it is still a new process, and I guess it just keeps on changing. It's probably going to keep changing for a while, but so basically there's a few steps to getting it. You don't get it from a pharmacy. You get it from a dispensary, a dispensary made just for medical marijuana. But you cannot go to that dispensary to get it until you have a card. And in order to get that card, you have to go to a doctor who prescribes it, basically. Or I know they don't call it prescribes it, but so the first step is getting to the doctor who is licensed to get that card for you. You'd have to see the doctor and be evaluated, and his decision would make the decision if you are a candidate for it, and then you get entered onto the dispensary website.
Well, let me just clarify a couple of steps. So what it is the state, it's still federally illegal marijuana, and there are some states who've chose to opt out of that federal program and say, listen, within our state, we want to make it legal. And so with that, they have put certain conditions. So Florida is one of them. They had started out with a whole list of very strict medical conditions that patients could only meet. End-stage cancer, rheumatoid arthritis, all these really bad things. And so, it was pretty much impossible for anyone to get it. They loosened it up a bit, and then they started adding ones that gave the physician some latitude to be able to prescribe it to patients who they thought would benefit from it. Patients who had seizures, patients who had neurologic problems, patients who had severe anxiety and insomnia. So then it got opened up to a whole lot more people. And so really what the process is, it's not really me approving it, it's me making a recommendation to the state that this patient, after I have evaluated them, would benefit or could potentially benefit from medical marijuana in any of its forms, whether it be THC or CBD, which are the two different forms. At that point, there's an application submitted to the state with some other data that we have to collect. The state processes that application and then decides to approve or not approve the patients. I can be honest that most of them are being approved, so that's a good thing. And then at that point, they notify the patient as well as us that the patient has been approved. At that time, the patient then is brought in for what we call dosing. And at that point, that's really it's almost like writing a prescription at that point. But again, it's not like a prescription because we don't write it on a piece of paper and they take it to the pharmacy and say, listen, you're going to take one, pill every 4 hours, blah, blah, blah. basically we recommend a dosage of these substances to the dispensary. Now the dispensary and the patient now, at this point, after we've made some dosage recommendations and route recommendations, in other words, how they're going to take it, whether it be a capsule, whether it be drops or inhalational, they decide with the patient what would work best for their condition and how they want to get it. And so there's a lot of different steps that, although are similar to traditional medicine prescribing, there's a lot that are a lot different that allow a wider latitude of use, as well as the ability, honestly, to get the best out of this medication, because frequently someone will just try one thing and it's not going to do what they want. So they're required, they can go back and they can change it and try this one and that one, as well as combinations. And they generally find some combination that works really well for them. Take that compared to like just a traditional pain medicine or some other medicine that we would use. It's either it's going to work or it's not going to work, and that's it. And there's no option. There's a lot more options. It's just finding what those are.
Yeah, and the dispensaries where you get them, like you said, are really, really good about working with the patients. And so we work with the dispensaries to make sure that they help, and it really is a pleasant experience. But getting started and with the application and all that, it is a little bit of a process, and it is a little bit annoying. So but we understand the process really well, and we pretty much hold your hand and walk you through and get you completely through the process the whole way.
Yeah.
And that's a big thing on our end.
Well, you have to do it that way because there's no way that a person would know how to do it. They could not navigate it on their own. And so the state doesn't want you to as well. And so really there is a lot of follow-up with them. The dispensaries, fortunately, are very well educated. They are very professional. These are big companies, unfortunately, but they're big companies that are national companies. And so, like I said, they're very professional. Most, if not all times when you go to a dispensary, you will go into a private room and discuss your conditions with those providers down there, and you'll come up with your things. So everything is done quite privately. There's no talking over a counter, hey, I need this, or you got that, which is
not at all.
Which is, really annoying when you go to a typical pharmacy. The pharmacist is yelling over the counter so that everyone's behind the counter over there on your side can hear what your problem is. Hey Joe, so you got you got diarrhea? Yeah, I still got diarrhea. So everyone knows what your freaking problem is. But the dispensaries are not that way. They're very private. So
yeah,
that's really a nice thing.
Someone asked, I've heard that patients can lose certain rights when they are approved for medical marijuana, controlled carry, like concealed carry, right to power of attorney, etc. Is that true? That's a good
I don't
question.
know about the power of attorney.
I know, I haven't heard that.
I haven't heard that one, but the concealed weapon permit is not. That we've looked at several times, and that has not been the case. I know that there are other states where they did try to take it out west, like in Washington State, where they did try to take people's concealed weapon permits away. And they were sued, and then they gave it back. Right. Okay. And so the reason being is really when you fill out a concealed weapon permit, there is a sign that talks about illegal substances, but it says illegal use of these substances. And this is not an illegal use.
Right. Within
Florida, this is a legal use because you have a prescription for this. So it is not, it is not one of those things. So the power of attorney, that I don't know, but I don't see why that would be.
I don't see why either. That would be kind of ridiculous, but we're going to wrap it up in about a minute. Anything else on medical marijuana?
Well, I think that people ought to know that there's also a over-the-counter form that's available, and that's just CBD. CBD comes from hemp, and hemp is a plant that's very similar to the marijuana plant, except that it is legal. And so that's considered a dietary supplement. There's no THC in hemp. And so there's no what we call psychoactive things. It doesn't cause you to get high or sleepy, but yet it works very well for pain. It works very well for arthritis and things like that. So it's something that people could try over the counter.
Okay, well, we are going to go to a quick commercial break, and we will be right back. If you are watching us on Facebook Live, we're not going to go to a commercial break. That's for the radio. We are actually going to bring on Lacey. We're going to introduce you to another one of our lucky team members here today. that we finally drug on the show. We have been trying to get Lacey to come on the show for a long time.
Yes.
But today she had no choice because we're in recharge. We're like, oh yeah, get in here. So tell us what you do here, Lacey.
I am the weight loss coach here, your consultant. Try to get you in the right direction when you come through the doors.
Yep. Lacey is the one that, you know, you get on her weight loss program and she puts you on your diet. And then when you come back to weigh in, like all week you're thinking, I cannot disappoint Lacey. I cannot. So she is, her face just keeps replaying in your head every time you want to go cheat and eat something. You're like, oh, I have to weigh in front of Lacey? No, I'm not going to eat that. For real, because every time we do anything here and I'm like, but Lacey, like I think about her all the time, like, but Lacey's going to weigh me. So, yeah.
But, you know, as a side, Lacey is our oldest employee.
Not oldest.
Well, I mean, I don't mean oldest. I mean, been with us the
wrong with
longest.
you?
Sorry. He's the
You're
wrong-
the
I'm
oldest.
I'm the oldest. I didn't mean oldest. Well, you know what I mean. They know what I mean. Yeah.
She's been here.
The
Savannah's next to Savannah
Yeah.
and Lacey. Yeah, she's been here with us for a very, very long time.
Mm-hmm.
She's like her
She
family.
does a great job with weight loss. I mean, just,
But she's like Chase too. She does all kinds of things here. She helps out Dr. Tieche. She does shots. She does lots of fun stuff. Yeah. What's your favorite part about being here?
My favorite part is working with patients, just hearing their stories and going from doctor to doctor. And then finally, when they find the answers, just the outcome, their transformation is unbelievable.
Cool. All right. So are we ready to go back on? Okay, Lacey. Thanks for coming.
thank you,
We're gonna go back to the
Lacey.
radio.
Sorry about being the oldest.
Yes. Okay, and we are back. Dr. Tieche and Cynthia just came back from a little commercial break, and if you were watching our Facebook Live, you got to see and meet Lacey, one of our other team members here at Recharge Clinic that does weight loss and all kinds of fun stuff. So if you're on the radio listening, when you get home, get on Facebook and check out our video, and you can meet Lacey along with Chase earlier. So we were talking about medical marijuana. We were talking about all kinds of fun stuff. Did you have any more about medical marijuana? One thing that you didn't talk about was the different forms. You briefly mentioned, but talk about the different forms of how it comes.
So when you actually get prescribed the medical marijuana, once you've received approval for the state, medical marijuana can treat a wide variety of problems. So really, there's within the marijuana plant, there's about 400 active chemicals, but they've isolated two really that we are allowed to use, THC and CBD. So THC is, people know about THC because if they've smoked marijuana before, they know people that have smoked it. That's really the active component in stuff that people get. It's about 95% in that. There's very little CBD. But when we extract them out, we take the active components, the good parts of the THC, and we use them to our advantage. So there are different strains of these plants that do different things. There's an indica variety that is very sedating. It helps people sleep. It works the best. It is the best thing for sleep ever. There's no sleeping medication that works better than THC. So that works great for that. So people, I see people over and over and over again who have chronic insomnia. They've been on Ambien, Trazodone, every kind of sleep medication. Anything to sleep, we put them on THC and they sleep great. Wow. The other thing is sativa, and that is a variety of THC that is very calming, and it helps really with very bad anxiety attacks, and it helps with panic attacks. And so it's very calming, but yet it's not sedating. So people can use that form during the day and be able to function. So
not just like, I'm having an anxiety attack, let me take it. It's just, you take it as maintenance to prevent anxiety attacks?
You can. It can be done either way. So when you're taking the medication, you can take it as a drop that would last several hours, so you could do it that way. Or you can what's called inhalation or vaping, where you smoke a little bit, which is the quickest way to work. It's almost instantaneous. So someone who's in the middle of a panic attack or middle of an anxiety attack, they can go ahead and let's say vape, and then it's going to break it pretty quickly, and they last for several hours. And then there's capsules, which are kind of very long acting, that kind of lay down a foundation medication for several to 12 hours. That's the THC component. The CBD component is really set up for a whole nother variety of medical problems. And these are more of the neurologic type problems. So it works well for seizures. It works well for tics. It works well for peripheral neuropathy. It works well for, chronic pain. And that is really one of the things that works really well for. So as you know, people who have chronic pain usually get prescribed opioids with very poor success. They may have gone through nerve blocks, surgeries, and all of the above, and have been put on gabapentin and all these different things. Sometimes they help, sometimes they don't. Pretty much all the people I see, none of them have helped. So they're having still severe pain. Or they're on narcotics, or they're on these other medications, but don't want to be on them for side effects. The state of Florida has made it really difficult to get narcotics now because they're trying to crack down because of all the narcotic abuse and overdoses, which is good, but the problem is there's been a lot of prescribers that are out there have been giving lots of narcotics. So now what are these people going to do? We have to get them off of that and onto something that is effective. So CBD is very effective for pain. It does definitely control pain. It's not sedating. In other words, it doesn't make you sleepy, so people are able to function at work and yet have pretty excellent pain relief and be able to wean themselves off of some of these pain medications. Now, some people are not able to get off of everything, but they're able to cut down dramatically. So big problem for people who have pain is typically having the pain and then being able to sleep, because the problem is their pain is keeping them awake. So sometimes a combination of the CBD as well as the THC that helps you sleep is really good, because now they're able to at least rest. Once they're able to rest, their pain level or their perception of their pain level goes way down because they're not so agitated. So those combinations work really well. The thing about, medical marijuana, it has been around since basically the beginning of time for 2,000 years. It's very safe. It's all plant-based. It was used in the U.S. really as a form of medicine up until Prohibition, and then it became illegal. So, there's really very few side effects to it at all.
I have another question, but is there another topic you want to talk about today? If not, I want to continue on this.
Good.
So why does it help with pain? Explain that.
Well, there are receptors in your brain, and as well as through your whole nervous system, there's cannabinoid receptors that the CBD binds to. Why those receptors are there, I don't know, but they are, and somehow they were placed there, and they bind to those receptors and they help decrease the pain.
Wow,
yeah.
Interesting.
Yeah.
So it's really kind of like a natural form of medication for us. Interesting. What about someone who has depression? Is it for that? Or more anxiety?
Yeah, it can help with depression and anxiety. It definitely helps with anxiety for sure. There are people who have had severe social anxiety where they were not able to leave their house because they just had such panic attacks, who are able now to function and go out and basically start to resume normal activities again. That's a very common problem that people have. It starts with a very just little bit of anxiety where people just are nervous about stuff, and then it starts to spiral out of control internally so that they start restricting their life down a bit because they get more and more anxious. So they get to the point where the only place they're really comfortable is confined within their house, and then even in that, maybe with only in a certain room. So it's really debilitating for them. I've had people that can barely sit in the exam room because they're so anxious, that now are coming in and just chatterboxes. They're just talking about that they went to the movies and they went here and they went there, and so it's a whole life event, and it's really kind of nice to see them change, because it's really pretty sad what they've experienced. There's not a lot of medications that are helping them.
So how would you handle this? Someone comes in and maybe they're a new patient for you and they are having anxiety or depression, or maybe can't sleep, one of these. So a lot of times it has to do with hormones, right?
Right.
So
I don't think, I think you have to go through, you have to be a doctor first. You have to go through all the medical things, and you just don't jump to one thing, although there are people that do that. But you have to go through all the things based on symptoms and kind of work on things. And then once things have been optimized, you kind of find out, well, this is certainly not a hormonal thing. This is this or that. And then you kind of try and narrow it down by those things and provide certain treatments. But when you maybe have gotten to the end of your rope, or you have tried other things and they haven't worked, or they've worked partly and you still have some remnants, that's when you add it in there as part of your treatment, because it doesn't mean it has to be the treatment. It's either one or the other. Sometimes it's all of them. Sometimes there are people who need hormone replacement and medical marijuana just because of our lives being the way they are. They're not mutually exclusive. They add together.
what's the success rate that you have with your medical marijuana patients?
I think the patients who use it properly have had a very good success rate. There are some people who are very timid about it to use, or have just tried it limitedly. They'll go to the dispensary, get one dose of it or one form of it, try it and said it didn't work and give up. And so I really try to emphasize that it's not an all or none thing, that it does require a little bit of experimentation or a little bit of adjustments. It's like making a chili. Everyone makes it a little bit differently. Everyone has a little bit more salt, a little bit more pepper, but yet in the end they're all chili. And so you just don't throw the whole batch away because it didn't taste. You try to fix it. And so
Find what works.
And so, there's a pretty good success. There's some people that just are against it from the get-go and have kind of been encouraged by their family to try it. It's probably not going to be very good because it's not going to work because they're not trying it. But I can tell you that most people have gotten some form of some relief from that. Insomnia is the biggest one. I can tell you that uniformly almost everyone gets, because that is one of the most common problems that I see that people are going on it, as well as anxiety. And those, it's awesome for.
And what about the pain people? Are they seeing results from it?
Yeah, they are definitely seeing good results. I would say that not all of them are getting complete pain relief, but you know what? They're getting enough pain relief so that they are able to cut down on their other medications, which have been inhibiting their life. I mean, people who are taking a lot of narcotics or a lot of things like gabapentin and stuff, they're kind of in a fog all the time. They don't really feel like they're right with it. So if you can cut down on those medications a bit and yet give them something that helps with their pain, but yet improves their clarity of thought, they are able to function more. So that is an improvement. Yes, did it go to zero? No. But did it cut it down so that you can cut this down and now you're able to function?
Yeah.
A lot of people have different expectations. Some people have an expectation that their pain is going to go to zero and so, yeah. But then there are people who say, listen, if I can get rid of part of this and I am able to just go to the store, I am able to just go for a walk with my spouse, I will be better. There is a lot of that's happening. And when you think about this medicine just being something that's just natural, plant-based, and how safe it is, it's pretty incredible that so many people get benefit from it over a wide range of symptoms. So to me, the more I prescribe it, the more I want to prescribe it, not because, I benefit in any way from it, other than the fact that people really do well from it. And so it's really worth a try. I honestly think that in some ways it should be the first line treatment. I think for people who have insomnia and anxiety, unfortunately, they're going to go to their doc, they're going to get put on Xanax, and they're going to get put on a sleeping pill. I think, honestly, if they got put on, THC to sleep and for anxiety, it'd be a lot better, and it's bypass a whole lot of steps.
Yeah.
But that's not how it works all the time.
Companies are not going to be happy about that.
No, they are not.
So, yeah, I mean, definitely, instead of taking some drug, like Xanax or something and getting hooked on that, why not take something more natural?
Mm-hmm.
And so it's not there. What are the dangers from it? I think we have a couple more minutes, so we've got time.
Very few. Very few. There's no overdosing. So unlike narcotics, you cannot die from it. So with narcotics, there are receptors in your respiratory center that the drugs bind to, and that slows your breathing down, and that's what would actually cause you to die by getting too much.
Wow.
There are no receptors for the cannabinoids in your respiratory center. So absolutely no way will it do anything like that. You can take all of the stuff that you get, and it's not going to do that. You may throw up just from all of the oil or something, or maybe get diarrhea, or fall asleep. That's pretty much it.
Wow.
But you're not gonna. Nothing bad's gonna happen to you. You're not. It's not. So it's not. It's a very, very safe thing.
And
the thing is too, when people are using these things, I think another interesting thing to do is, marijuana is somewhat calming. Most people know that, people that smoke pot are kind of pretty mellow. And that's another big thing to know. When people are using alcohol and other medications, sometimes they get violent, sometimes they have really bad mood swings. That typically goes away with this. So in a way, there's no violent crimes going to be committed with, medical marijuana, not like with crack and meth and stuff. People are not doing it. They're just kind of sitting at home being mellow, maybe eating a bag of Doritos, but that's about it, So there's a lot of other pluses to it.
And so someone who doesn't like that sedating buzz feeling. They don't have to get that.
No,
There are strains.
Absolutely. Well, you know, if you're going to having pain, you just kind of use the CBD only, and then, or you can use the sativa, which does not have that sedating thing. And you know, everything is dosed. You know, there's varying doses to very strong to very mild. So you know, if you, of course you start on something very strong, you are going to have those effects. But if you are starting out very low, you're not going to experience that.
All right. I think we will start wrapping it up. If you have questions, you can come see us or check out our website, rechargeocalaclinic.com. We offer free consultations to just get in the door and start somewhere with us. So give us a call or check out our website, and we will see you next week.